There's been a lot of discussion about experience, insights, as well as potential for conflicts already in this hearing today. Obviously, experience and insights can be extraordinarily helpful, but we've heard, from the president that he wanted to drain the swamp. We've heard phrases like foxes guarding the hen house and the revolving door. So noting that the perspective that you would bring, having served in a large pharmaceutical corporation in a leadership post, brings a very specific perspective, especially as we tackle one of the critical problems of our day, the high cost of prescription drugs, oftentimes life-saving and life-extending medicines for our constituents. We had a hearing recently in this committee on drug prices, and I felt that there was a lot of finger-pointing from the folks who were at our DS talking about whether they were from the perspective of big pharma or pharmaceutical benefit managers or all of the other players in this, this system, and citing complexity, citing it's their fault, not ours. But because of your background in the pharmaceutical industry, I'd like to not hear finger-pointing, but what can be done. I have many constituents who share their very personal stories about their challenges with the increasing and skyrocketing costs of, again, life-saving or life-extending medications. Greg from Stoddard, Wisconsin, has 2 adult sons, both with type 1 diabetes, and they are now expending over $1,000 a month just to maintain insulin and test strips. When you were president at Eli Lilly, you were there during a time that there were really radical increases in insulin prices. It increased more than 1,000% since 1996 and over 200% during your tenure. Can you tell us, and more specifically Greg and his 2 sons with type 1 diabetes, why Eli Lilly and other companies are systematically increasing the list prices of drugs that are already on the market?
So, Senator Baldwin, thank you for that question, and also thank you I really enjoyed our discussion the other day on this and other issues. So, first on the finger pointing, I've actually been really clear, even when I was at Lilly, on this issue of drug pricing. Finger pointing is not a constructive enterprise. Everybody owns a piece of this. Everybody in the system owns a piece of this. And I think the government owns a piece of this, and that's why I want to serve, because I think that the experiences I bring can help me with the government on trying to drive change that one company can't actually necessarily impact.
So I appreciate that, but my question specifically is, what would you tell Greg and other constituents about Eli Lilly's role?
Yep, and the insulin prices have been significant as increases have been significant for all drug prices pretty much, and the problem is that system. This system makes it so that and Greg and his kids.
The system. So I should just tell them it's the system.
And the system has to get fixed. That's the problem. That's the
problem.
What
about the drug manufacturers are the starting point. They set the list price. What should I tell Greg about the 200% increase during the time you were there in the price of insulin?
That what we need to do is work to fix so that Greg and his kids have insurance that covers that insulin, so they have low out-of-pockets, so that the drug companies, so that we got to get the list prices down also. We need to come up with...
That starts with the drug manufacturers.
It does, you're correct.
And this feels reminiscent of the hearing we just had of it's a complicated system and it's this and that. it starts with the manufacturers setting the list price. Now we've talked, and I see I'm already hitting my time, and I had lots of questions. Maybe we'll have a second round, but you've talked about generic and branded competition. You've talked about fighting the gaming of the patent system and exclusivity. There's a bit of Q&A about reimportation. The two things I wanted to talk about, should we get a second round, or I may submit written questions, is the role of transparency and getting the pharmaceutical companies to justify their increases in price. I have a bill along with Senator McCain to require that for companies planning on increasing their prices. And secondly, the role of negotiation, somebody in your role directly with the pharmaceutical manufacturers.